28 million Americans have no health insurance. Over 100 million Americans have medical debt. And every single year, over 500,000 Americans go into bankruptcy because they needed to see a doctor. Think about that for a second. In the wealthiest country in the world, people go broke and file for bankruptcy because they had to see a doctor. That's not healthcare, that's sick care. Millions of Americans skip doctor's appointments just because they can't afford the copay. They split pills, stretch out prescriptions, and avoid going to the ER because a bill might make them go broke. And while millions of Americans are deciding whether they should pay for their rent or their medicine, insurance executives are cashing million-dollar bonuses. We don't have a healthcare system. We have an industry designed at profiting from our illness and not treating it. But here's the part that makes no sense. America spends over $5 trillion every single year on healthcare. That's more per person than any other country in the world. Yet millions of Americans still can't see a doctor when they need one. And even people with private insurance face skyrocketing premiums, surprise bills, and deductibles so high they might as well be uninsured. Meanwhile, Medicare runs more effectively at lower costs and with higher satisfaction than any private insurance. If we expanded that system to everyone, studies show that we would save roughly $500 billion per year and make sure no family ever goes bankrupt because of illness again. Healthcare should not depend on your job, your income, or your zip code. It's time to guarantee healthcare for every American, not just those that can afford it. Because healthcare isn't a privilege, it's a human right. Here's how I would address healthcare in this country. I would help pass the Medicare for All Act, which would provide universal healthcare coverage for every American. No premium, no copays, no deductible. Full coverage for medical, dental, vision, mental health, and prescription drugs under one public system. We're going to increase investment in rural and underserved communities. We'll expand telehealth, mobile clinics, and community health centers, so every single American has access to quality healthcare, regardless of whether or not they live in rural communities or underserved urban neighborhoods. We need to address the doctor and nurse shortage in this country by increasing funding for medical schools and residency slots. We need to forgive student debt for healthcare workers that work in underserved areas and communities. And we need to expand training for nurses and physician assistants. We need true prescription drug reform in this country. Medicare for All will finally be able to negotiate drug prices with Big Pharma. We'll cap insulin at $25 a month. And we'll end patent loopholes that keep affordable generic medication off the market. We'll treat healthcare like what it should be, a lifelong investment, not a crisis response. We need to make investments in preventative care, maternal health, and mental health services that treat people while they're healthy and before they get sick. This isn't radical, it's common sense. No one should die because they can't afford to live. No one should lose their home because of a diagnosis. We spend more money on healthcare than any nation in history. It's time that money actually went towards care. Medicare for All would simplify the system, cut waste, and put doctors and patients, not insurance companies, back in charge of the system. Because this isn't about policy, it's about people. It's about you, your family, your friends, your neighbor, your future. Healthcare is a human right. Let's make America act like it. To learn more, visit www.mattconroyforcongress.com